Happy to be here. I am a psychiatrist, an addiction psychiatrist, and specializing in addiction medicine and president of the American Society of Addiction Medicine, as you see there on the slide. Next slide, please. What I want to do is just give a brief review and overview of the waves of the overdose epidemic as we've been experiencing them and living through them. What you see here is a graph of U.S. overdose drug overdose deaths in and this is the 12-month period ending and you see this is based on data that's available for analysis as of August 3rd of 2025. So as of last month, so really right up to the present time, as close as you would ever be able to get. And what you see is that the huge increase in overdose deaths that we experienced in this country is really starting to abate over the last couple of years, and yet we are nowhere near where we need to be. There is still a significant huge prevalence of overdose deaths in this country, with the rates being about what they were pre-COVID, but that still represented just intolerably high overdose death rates. Next slide, please. I want to make sure, I don't know if I'm coming through loudly enough for people.
Can hear you perfectly, Steve.
Okay, great. All right. So here is the common conception that we have of the various waves of the opioid overdose and addiction epidemic. Wave one, which we would say started in the early 2000s, was really driven by prescription opioids, use of, addiction to, and then overdose deaths of prescription opioids. Wave two, we see that starts around 2010 with a rise in heroin as various efforts were made to make it much more difficult to access and obtain and misuse prescription opioids. Wave three starting not long after that, frankly, in 2013, with a rise in the use of fentanyl as people with addiction develop a greater and greater tolerance to one drug. There becomes a need for a drug that is stronger and more potent. And it's notable that in both wave two and wave three, there really isn't a big presence of stimulants driving this wave of overdose deaths. It really was heroin in wave two, fentanyl wave three, but then in wave four, we see starting in 2015, a rise of overdose deaths with fentanyl, but with stimulants frequently as a part of the cocktail of drugs that results in an overdose. And I've taught for many years about the fact that addiction is not a drug-specific disease, and so it should not have surprised anyone that this overdose epidemic for a while started with primarily opioids as the drivers, but before very long, stimulants were also included in it. And so you can see the red line shooting right up towards the sky, just as you see with the blue line of fentanyl with no stimulants. And so that's the fourth wave, and we are still in that fourth wave a good 10 years later. Next slide, please. It's important, therefore, to understand stimulant misuse and the whole phenomenon of stimulant use disorder, because obviously we have FDA-approved medications for treating patients who have opioid use disorder, but not so much with stimulant misuse and stimulant use disorder. And what you see on this, depicted on this slide, is the fact that 9 million people aged 12 or older reported past year stimulant misuse. And you can see the breakdown here: cocaine use only for 3 million people, cocaine use along with prescription stimulant misuse, but not including methamphetamine for 625,000 people, prescription stimulant misuse only for 3 million people, cocaine and methamphetamine use, and prescription stimulant misuse, just everything included for 147,000 people. And then you see the rest of the numbers there, which I won't read all of them to you. The bottom line is a tremendous number of Americans reported misusing stimulants. And again, this is data from SAMHSA from this year, 2025, indicators of key substance use and mental health indicators, and NISDA data, National Study on Drug Use and Health data as well. Next slide, please. And so what's important that we understand is that the ASAM criteria, I mentioned at the outset that I'm the current president of the American Society of Addiction Medicine, better known as ASAM. The ASAM criteria are very important tool for determining the level of care that people need, and also as people progress through treatment, helping to figure out what level of care they still may need as their treatment course continues, recognizing that if we are in fact making treatment be something that's tailored to the needs of the individual patient, then that level of care and the intensity of care that people will need along the care continuum will change as a person progresses through a course of treatment. Next slide, please. And what's also important to remember is that, again, there's not as much of a robust set of data for understanding the management of patients with stimulant use disorder as there are for patients with opioid use disorder. And so we got together, the American Society of Addiction Medicine, and our then president, Dr. Brian Hurley, headed up a team of ASAM professionals and researchers who got together with the American Academy of Addiction Psychiatry, our sister organization, and came up with this clinical practice guideline on the management of stimulant use disorder. And the important findings of this clinical practice guideline are widely available. We encourage people to access them. But one of the things that was clearly concluded in this clinical practice guideline is that contingency management is the treatment of choice for treatment of stimulant use disorder. And that's an important finding. It's the reason why I wanted to make sure this was mentioned in this particular conference. Next slide, please. In that clinical practice guideline, what you see is highlighted, again, the fact that contingency management should be primary component of the treatment plan. But as with any kind of treatment for patients with substance use disorder, it is one of several components. So this is the primary component, but it's in conjunction with other psychosocial treatments for stimulant use disorder. And you can see here some of the other treatments and interventions that have the best evidence supporting their use and their implementation alongside contingency management. So, for example, community reinforcement approach, the cognitive behavioral therapy approach, as well as the matrix model. And so recognize that it is a standard practice. It is an evidence-supported practice to provide a number of different psychosocial treatments for patients with stimulant use disorder. And clinicians can, as you see in that last bullet point, can consider offering these various evidence-based interventions, behavioral interventions, via a number of different platforms. And so you see there's digital therapeutics or web-based platforms as add-on components. But we need to emphasize that these other options should not be used as standalone treatment. Next slide, please. I'm going to stop here. I will be available for questions as is necessary and as will be helpful for folks on this call.